Welcome to Community Conversations. I'm Frederick County Executive Jan Gardner. Joining me today is Dr. Barbara Brookmeyer, who heads our health department. Welcome.
Thank you for having me.
I thought we'd start off today by talking a little bit about substance abuse. Certainly, there's a lot in the news about the use of heroin and the overdoses and fatalities associated with heroin. Can you share a little bit about what the health department is doing to try to address this particular issue?
Yes, I'd love to, because for years we've been providing substance abuse treatment for adults and adolescents, and we've had some, in years when funding's been better, we've had more prevention programs. But in the last couple of years, we've been able to focus our efforts on especially heroin, but opiate overdoses. And some of the things this year that we've done is we have an exciting pilot program using our peer recovery coaches. So, and I can describe a little bit more of that later, but we just signed an MOU, a Memorandum of Understanding, with the Frederick Police Department and 211 call center to call our peer recovery coaches. So they're folks who have completed a national program on peer recovery coaches. They're individuals who have, in most cases themselves, had issues with substance abuse in the past or a close family member, and they've completed our 40-hour training program plus additional training that they've needed afterwards to complete their certification. So anyway, so this exciting pilot with the Frederick Police Department and 211 will be putting in place a system where at crucial points in someone's addiction, the police department will make referrals through 211 to our peer recovery coaches. And so those crucial points are when a drug-related warrant is issued, when after central booking, and then also during community policing. They might, the police might run into somebody who they think might benefit from knowing that there are recovery coaches available. And then for 211, we have also been able to support some enhanced training for them, greater training in addiction, so that one, they'll be better prepared to serve as the call center and dispatch, and then also to better help any callers who call in looking for substance abuse.
So what does a recovery coach do? What role do they have if they're contacted through 211 or directly by the police?
So the recovery coaches, well, here, I'll describe another program that we have, and so I'll give you some details on that so that I won't repeat too much. So we're also starting shortly a pilot program with Frederick Memorial Hospital, where we will actually have embedded in their behavioral health unit and their emergency department a peer recovery support specialist. So basically that's someone who has completed our peer recovery coach academy and then the additional training to get their certification, and then they're actually, instead of just volunteering for us, they actually work for the Frederick County Health Department. But that person will then be on call to receive, or will work there embedded in the behavioral health unit and the emergency department to receive referrals to then, for folks who have an addiction problem. And what the peer recovery support specialist will actually do is to assess the individual where they are at this time in their addiction and identify what needs they have and what needs they're interested in having met, and link them to substance abuse treatment or mental health treatment in the community, to help them with health insurance, signing up for health insurance. A big one is navigating the system, especially for folks who are looking for treatment, inpatient treatment, how to navigate that system, because it can be, when someone's in crisis, you know, it can be quite difficult. But then also there are a variety of other supports that people need in order to get on the path to recovery and maintain their recovery, such as transportation, other community resources that are out there. And so that's what the peer recovery support specialist will do. Starts off with an assessment of the individual. Where are they? What are they interested in? What are their needs? And helping to respond to all those needs, help get them linked to all the community providers that can help them.
So once an individual is connected to a coach, what does that peer recovery coach do for them?
Well, it depends what the person's interested in, because again, it's based on what the individual is interested in. Some folks, so say some folks, they maybe, well, so say there's that term commonly used, fall off the wagon, which I have to say I'm not sure if that's an accurate term or not. But so folks who have gone through treatment before and know what they need to do, but need some additional support. And so that's where so our peer recovery coaches, who they've been through it and they understand, and they've been through the issues with family, with friends, with the community, and
so
often
they understand it.
They understand, and often just knowing that there's somebody else out there who has done it and who has made it, that alone is a big help for folks. But then they also have practical tips, both from their own experience as well as what they've learned through the training and the experience that they've gotten afterwards.
So this can be a long relationship then, so between a coach and a client, or so that if somebody feels like they're going through treatment and they feel like they're at risk of falling back, and they have someone to call who can maybe give them some assistance and who understands it. So I think of it in my mind as somewhat like the AA model, where they have somebody to talk to, somebody who will mentor them, and not just help them connect to services, but also to really provide that emotional support or that behavioral health support.
Right, and we believe that's a major factor in the effectiveness of these programs nationwide, and the fact that the folks, the coaches receive specific additional training, intensive training, moves them up from the lay person who wants to be helpful to someone who actually has now some evidence-based approaches or skills, so that they are more prepared to be able to help somebody and also protect themselves too. So we believe that the Recovery Coach Academy, which, did I tell you that we've trained over 135 folks so far?
No, you haven't.
I've trained, gone through our Recovery Coach Academy. We were the first in Maryland to offer the certified program. And
so are we still one of the only counties in Maryland, or have others come on board?
I believe there are a couple others who have now offered Recovery Coach Academy as well.
And the outcomes, we know that this works well, or that we have better outcomes with the recovery coaches?
Yes. So we know from research studies that are from outside of this area, yes, effective, and from our early information, it definitely is promising, and we believe, not only effective for certain individuals, but when we look at it over the population that we serve, that it should be an effective adjunct.
What other promising initiatives is the health department working on to decrease substance abuse and drug overdose? Because we know, we talk about heroin because that's been in the news, but substance abuse has been around for a long time. And so can you talk about what else the health department is doing?
Yeah, so sort of on the other spectrum of things, so for overdose prevention, and we figure if you can prevent an overdose, then there is more hope that the individual will actually make it into treatment. Because if the person dies from an overdose, then for sure they won't be able to benefit from treatment. So, at the far end of the spectrum there of the types of services we offer includes naloxone, which is a medication. It is available for intranasal, so in the nose application, but it's a medicine that reverses the effects of opiate medicines or opiate chemicals. So that can be heroin, it can be pain pills, and so that medicine can reverse those effects. So say someone ends up having too many pain pills or overdoses on heroin, and then it's in the heroin on the brain puts someone into an unconscious state. Well, this medicine, if given early enough, can end up reversing those effects immediately. It's actually an immediate reversal.
So we've trained police and fire and other first responders, but are families using this as well?
Yes, well, we have trained, the Frederick County Health Department has trained over 544 folks.
Wow.
So that's the Frederick Police Department, the Frederick County Sheriff's Office, the Thurmont Police Department, and then community providers. So residential treatment providers, halfway house, anybody who offers mental health or substance abuse treatment, they have learned. We've also partnered with some community organizations such as Project Hope and the Carbaugh Foundation to bring the training to the rural and, locations outside of the city of Frederick, because we know that transportation is a big issue. So we have provided the training there, and so far we have 13 documented saves. So quite possibly those 13 individuals would have died had they not gotten the naloxone and gotten it timely. And then our EMS folks have carried the medicine for years and have been using it for years. It's part of their protocol.
Okay. So what has the health department done to try to improve training and continuing education for our behavioral health providers out in the community?
Yeah, so that's one of the things that we also pride ourselves on is one, for our clinicians, our mental health providers, and our substance abuse treatment providers at the health department to make sure that they're up to date, that their skills and their knowledge is up to date with the most current evidence-based practices and approaches. And we also like to be able to bring that to the whole community. And for example, we have training that is sponsored by and brought to us by the National Institute of Mental Health, and it's for all clinicians. We have over 100 clinicians who have been signed up for that, and it's about treating resistant depression and suicide. So we're definitely looking forward to that. And in past years, we've held trainings for the clinical community as well as the general public. The one that was the largest or oversubscribed participation was one on the synthetic cannabinoids.
Okay.
And that one we had over 200 people. We had to keep changing the venue. That's why it sticks in my mind, is because as the registration numbers increased, we had to keep moving the location that we were holding the event.
I don't think people recognize how the important role the health department plays in maintaining that continuing education for our paid providers, our private sector partners out there in the community. So that's a real accomplishment. Now, if someone is viewing this and they know someone in their family or their community that is struggling with substance abuse, what would you recommend that they do?
Well, the quickest response is to say call 211, but as I mentioned earlier, we're working on building up the capacity and the knowledge of the folks for 211, so that's dialing the number 211 for all kinds of health and social services resources. But the other thing is that people can actually directly call the Frederick County Health Department, and I would not want to give you the wrong telephone number, so I think we'll have it on the screen.
Yes, we'll have it on the screen. Well, thank you for joining me today. As substance abuse continues to be in the news and of interest to people in our community, I think it's important to know that the health department and simply dialing 211 can help people obtain some information and resources they need. Substance abuse is not an easy cure. It's something that takes an investment of a lot of time. It really needs families and other support groups to be involved. And so we can't do it alone. We need the community. We need our private sector partners. But we thank you for providing the information, the leadership, to make sure that all these other organizations and partners that we have can be successful and stay up with what's happening. So thank you for joining us today. I hope you learned something about what the health department is doing in our community and the great value that it's providing. And if you do need assistance, please call 211 or you can call the health department.